Hey guys, Savannah Bell here with My Massage World, and today's video is all about busting some of the most common myths that still seem to exist in the industry despite having been debunked for years. Now, I know I usually do more business-specific sort of videos, but this needs to be covered, number one, just because you need to know, but also because you can't exactly be taken seriously or treat your clients effectively and therefore grow your business if you're perpetuating these myths. So there's a lot of misinformation out there, a lot of things that are still being taught to this day that are completely outdated and have no scientific backing whatsoever. Myth number one, massage should not be performed in the first trimester of pregnancy. Now, this whole idea is based on the theory that massage could somehow trigger a miscarriage or preterm labor. Let me first say there has never, ever been a case where massage has been linked to a miscarriage or preterm labor. Miscarriages happen in about 15% of pregnancies, and as horrible as that statistic is, that's just the way it is. And most of these occur in the first trimester. Miscarriages are more than likely caused by some chromosomal defect or other anatomical or physiological issue. This idea that you can't touch a pregnant woman in their first trimester for fear of causing a miscarriage is it's completely false. It's fear-mongering. If that's the case, then you should start handing out pregnancy tests at the door for all your female clients, because most women don't even know that they're pregnant until at least halfway through the first trimester. Now, if you don't want to take the risk of a client blaming you for a miscarriage that you had nothing to do with, of course, but people lash out sometimes during traumatic experiences and loss, it is perfectly fine for you to turn them away. However, please, for the love of all things holy, have a prenatal therapist that you can actually refer them to, and do not tell them that they can't get massage while they're in their first trimester. Unless there are some serious high-risk factors, a general relaxation massage is perfectly safe. And if you don't feel comfortable doing that, or you just want to cover your own ass, that's fine. Just have somewhere to send them so they're not left completely without. Right? Now, as for the myth of these pressure points on the ankles and wrists that could spontaneously cause a miscarriage or preterm labor, absolutely false as well. Okay, first of all, if women had a magic button like that, we wouldn't need Pitocin to induce labor. And my daughter would have been born much sooner than she was, because those last 2 weeks past her due date were hell. And secondly, the entire concept of pressure points, if you prescribe to that belief at all, is that they're meant to bring balance to the body, not upend some really complex biological process. So why on earth should they suddenly be off limits? That's like saying that somebody who has a heart condition, you better not work on any points related to the heart because they could have a heart attack. It makes no sense. So no matter what, get training in prenatal massage if you ever want to work on pregnant clients so that you know what you're doing. But please don't spread this myth that massage is somehow dangerous for pregnant women at any stage. They're not fragile little flowers that are going to fall apart at any second. Myth number two, massage is contraindicated for those who have cancer. This is completely false and has been debunked since probably the 90s, but is unfortunately still taught. The theory surrounding this is based on the idea that massage could potentially spread cancer because there may be some increase in circulation caused by the massage. But again, this has been proven to be false. That's like saying that walking or general exercise would spread cancer. Metastasis is an extremely complex process, and massage will have no effect on it. There are a lot of nuances to oncology massage and a lot to understand about medications and treatments and side effects and all that good stuff. So either get training in oncology massage if you're going to be working on somebody who currently has cancer, or find a therapist that you can refer those people to so that they can get the best massage possible. Now let's take a gander at one of the most pervasive, myth number three. That massage releases toxins and that somehow we are squeezing these horrible toxins out of the muscles during massage, and our clients need to drink a lot of water in order to flush them out or they'll be sick the next day. Now, because all these toxins are just floating around in here. This is completely and utterly false. First, before we get into the physiology of what's happening in a massage and why this idea simply is not true, we have to define what we mean by toxins. So this is such a buzzword. Everybody wants to have the latest and greatest thing to rid the body of all these evil toxins, but very few ever mention what they're actually referring to. Toxin is just like a catch-all term. So a toxin is defined as any kind of poisonous substance that can cause harm to the body when it's introduced. So that could be things like nicotine, it could be alcohol, heavy metals, things like that. But the body has a pretty cool self-cleaning system that takes care of most of these things at the normal levels at which they're usually, introduced into the body. It's called the liver and kidneys, which work to filter and excrete these real poisons from the body. If you want to get real technical, you could throw in respiratory system and skin and colon in there if you want to talk about all the ways your body gets rid of toxins, but liver and kidneys, big ones, okay? For the everyday stuff that we're all exposed to, or even some excess that people may put themselves through, the body handles it really well all on its own, as long as it has some proper nutrition and hydration to keep the liver and the kidneys functioning properly. And then there lies this idea that these toxins are just somehow sitting in our muscles, waiting to get squeezed out with a good old-fashioned massage.
That's not how it works. That's not how any of this works.
Let's look at an example of a real toxin, like heavy metals. When the body is exposed to high levels of heavy metals, especially chronically, the last place that it wants to store that excess that it can't flush out, that's struggling to get out of the body, is in the muscles or near any vital organ. Our bodies are pretty dang smart. When it comes to storing something dangerous, it's going to store it as far away from our vital organs and our nerves as possible. So oftentimes, it's actually stored in the bones. And the last thing you want to do, even if it was physiologically possible, would be to stir all of that up and overload the liver and the kidneys trying to flush it all out. If massage could release these toxins and somehow rid the body of toxins, doctors would have been prescribing massage therapy sessions to everybody in Flint, Michigan instead of actual medicine. Now, I love massage and it does wonders for the body, okay? Huge proponent. But releasing toxins is not one of those wondrous things. But we also can't talk about this myth without mentioning the ever-famous lactic acid. Now, the massage industry has done a dang good job of demonizing lactic acid as this horrible toxin that sits in our muscles and causes pain. And some even teach that muscle knots are big hunks of lactic acid that we need to squeeze the bejesus out of. But yet again, this is untrue. Lactic acid is a normal byproduct of glycolysis. And without getting super technical and losing those of you who do not want another physiology lesson, let's keep this simple. So lactic acid is normal. It is supposed to be produced by the muscle for fuel when there's not enough oxygen. But it can be dangerous at high levels, so the muscles will basically reach total fatigue and shut down once lactic acid levels get too high. Then it's just a matter of enough oxygen getting back into the muscle to reduce those lactic acid levels. Hear that? Once the muscle has enough oxygen again, all that evil lactic acid is gone. So this lactic acid isn't just sitting around in muscles for us to squeeze out. It's converted back to its original state, usually within about 15 minutes or so after strenuous exercise has stopped. The oxygen levels are replenished and lactic acid levels are back to normal. In fact, one study even states that massage, quote, impairs lactic acid and hydrogen ion removal from muscle. Hear that? Massage may actually slow down the process, not speed it up. So what are those knots if they're not lactic acid or some buildup of toxins? More than likely, they're a normal anatomical structure. Okay, think of that horrible knot that everyone has at the superior angle of the scapula. It's usually pretty pronounced in most people, right? But isn't it interesting that we somehow all store this supposed toxin in the exact same place? That's because it's not some toxin, it's normal muscular structures. You have your levator scap attachment, a pretty thick tendon, sitting just under the trap. That leads to this feeling of a knot. That's why you can't ever get that out, you can't get rid of it, because there's nothing to get rid of. Why is it tender on most people? Because it's a freaking tendon. You dig into any tendon on just about anybody, and it'll probably be pretty tender. Now for some, those knots that you're feeling may actually be scar tissue from a previous injury. Perfectly plausible. But please have an in-depth understanding of anatomy so that you know the difference. All right, so the last part of this whole thing to dismantle, since we know that knots are not lactic acid or any other toxin, and we know that massage isn't squeezing that sort of thing out of the muscle and circulating junk throughout the body, then why do some people feel sick after a massage? It's really up for debate. There's no clear consensus among medical community of why this is. But let's look at some possibilities. First, a lot of people are somewhat dehydrated, but not enough to really show in the way of symptoms. And massage has a diuretic effect on the body, so it's possible that they're just slightly more dehydrated to the point of showing symptoms after a massage. Hence the reason it's important that they drink water, not to flush out toxins, but to replenish any water loss that's actually caused by the massage. Plus, a little extra water doesn't hurt anybody. Okay, now, do they need to chug hundreds of ounces after a massage? No. An extra glass or two is probably plenty. It's also possible that their soreness and headaches and those sorts of things are positional in nature. Some people may feel fine laying on a flat surface for a while, but keeping their neck or their back in that unnatural curvature may prove to cause some irritation that isn't felt until later. I know for me personally, never bothered me to lay on a flat massage table. Never. Done it hundreds of times over the years. But after I had my daughter, I had to start using a towel or a pillow under my neck every time I got a massage because I could no longer get a massage without getting a pretty serious cervicogenic headache shortly after. Something about, I don't know, the relaxin during pregnancy and a history of whiplash and neck problems anyway, I guess just caused some extra laxity or something that simply doesn't allow me to lay flat like that anymore. Don't know why for sure, don't really care, just know that having my neck supported when laying flat helps prevent a headache now. And yet another theory surrounds the idea of rhabdo, which is a condition often associated with severe tissue damage, like what people may experience after running a marathon or with crush injuries. But it may be possible that with deep pressure, especially, that we're causing some very mild form of rhabdo. What this is a rapid breakdown of muscle tissue causing a significant release of myoglobin that results in nausea and muscle pain and weakness and brain fog, all characteristics of that post-massage flu-like feeling. While nobody wants to admit that we're possibly causing muscle damage, with some serious deep tissue or deep work before we've warmed up the tissues and calmed the nervous system down, it's quite possible that we really are. So let's try not to blame our clients for their own soreness after a massage for not drinking enough water, when in reality, it may very well be that we damaged their muscles. Now, that is not to say it was pure harm to the body. Sometimes you gotta break things down, okay? Just like working out, sometimes you have to break down tissues in order to build them up, but that is a whole debate for another day. All right, while there's a lot of misinformation and a ton of things that are taught incorrectly or only halfway, to keep this short, I just wanted to hit the 3 big myths that I hear over and over again. So I hope this helped clear up some of the nonsense that's so often spread through our profession and give you a better understanding of what massage can and cannot do. If you've got an idea of a myth that you've heard before or that has been debunked, let us know. If you want more of a clinical or scientific approach to your work, I've got a clinical massage seminar coming up in East Tennessee in December. You can check that out on our website. It's already more than half full, so if you want it, grab a seat now. Thank you so much for watching today, guys. Be sure to check us out at mymassageworld.com, like us on Facebook, subscribe to us on YouTube, and stay tuned for more videos.